Good morning, good after, good evening, everyone. Welcome to this conversation around, addressing gender transformative approaches, and answering collectively what does it mean for men and boys or their work with men and masculinities. We are happy to have you here, all of you. So welcome everyone. We are happy to have, very talented and knowledgeable speakers with us today that will be bringing different perspectives to have, this collective conversation. In order to start, I would like to invite Magali Marquez from Men Engaged Secretariat. Magali, would you like to give us, some introductions around the symposium and some, details about how we can enjoy better this conversation today?
Thank you, Jose Roberto, for the introduction. Good evening, good morning, good afternoon, everybody. Happy to have you all back with us for this week in addressing gender transformative approach. So, what does it mean for um, men and boys? If you are savvy with the social media and you want to use the hashtags that we have been using for the symposium to follow the event. This is what we've been using: Ubuntu Symposium and Symposium Ubuntu in Spanish and French. So please feel free to spread the word of what we're doing today and what we have been doing um, for the past few months. Over to you, Jose Roberto.
Thank you, Magali. Thank you for welcoming from the um, Men Engage Secretariat. We are really grateful for having this conversation with you. We have been participating, along the different symposiums in Brazil, in Delhi, and now, this symposium that we all know that because of COVID, we are online, but it's giving opportunities for us to connect each other, using different streams. So thank you so much, Magali. And now I would like to invite, everyone. This is Jose Roberto Luna from UNFPA headquarters. I'm the technical specialist on adolescents and youth child marriage from the technical division. I will be moderating this session and I would encourage everyone to use the chat box if you have, we are shaping this roundtable as a collective conversation where, different panelists will be bringing different perspectives, that complement each other around, gender transformative approaches and how this is relevant for, the work on masculinities or transforming masculinities. And we will do so, and we expect that you, as participants, can also bring your own perspectives. So you are all invited to use the chat box, and I will be recovering your reflections, your contributions, and we would like to recover all the experience you have from the country perspective. We will have, the conversation today, showcasing some, country examples from Brazil, Chile, but also, having a conversation coming from, the work around the world from a global perspective and conversation. So without further ado, we would like to just remember that gender transformations means that we are addressing the root causes of, gender inequality, and we should be able to redistribute power, redistribute resources, transforming, gender discriminatory norms, but also providing, different streams for and opportunities for transformation. That also means that we have not only the agency, but the policies, the capacity to really transform. So I would like right now to invite, without further ado, Layla Sharafi, who is the gender advisor from, the Gender and Human Rights branch from UNFPA Technical Division. And we all are going to discuss, what does addressing gender transformative approaches mean for men and boys. And Leila, we would like to hear from you, particularly what does gender transformative approaches and working on masculinities mean? And particularly in relation to the agency and what CSC can do around that. So over to you, Layla.
Thank you so much, Jose Roberto, Magali, and to Men Engage. It's a delight to be here again. To answer your question, Jose Roberto, I think maybe I'll just start off by saying I'd like to connect it to SRHR, Gender Transformative Approaches, coming from UNFPA. No surprise that, I'd bring this angle in. But what I would like to say is, look, I think many of us know what the statistics are around sexual and reproductive health and rights, especially as it relates to women and girls' agency. Newest data that we published, including featured in our recently launched State of the World Population Report, which was launched yesterday, shows us that really only 55% of women and girls globally make their own decisions when it comes to being able to say no to sex, accessing healthcare, and making decisions around contraception. And my colleague Marten will be talking more about that later. So we know that that agency and decision making is lacking. We also know that adolescent birth rates are still unacceptably high. And maternal mortality is also very high. So in terms of sexual and reproductive health and rights, there are issues and challenges that affect everyone. In terms of gender transformative approaches, what it means for men and boys vis-a-vis sexual and reproductive health and rights, a recent assessment showed that the vast majority of SRHR interventions that are engaging men in these programs are not gender transformative, right? A very small fraction. And you can find that work online by WHO and many other academic researchers. And I'd be happy to share that with you in the chat later if anyone has questions. But we know that there are some successful ingredients, including making sure that within those programs, when you're engaging men, to make them gender transformative, making sure that they include education, modeling positive behaviors. We know that multi-level programming, right, which goes beyond just the target group, but engages the whole community really on egalitarian gender norms works. We also know that working with both women and men, either in mixed sex groups or separately, is really helpful. And then, what's critical is that you invest the time to make them gender transformative. So you really want to deliver activities with trained facilitators over a sufficient duration of time, ideally longer than 3 months. So that's a little bit about gender transformative approaches when you're engaging men in SRHR. We know that the majority isn't gender transformative, but we have a little bit of data that shows what is successful ingredients. I want to zoom in a little bit on gender socialization at an early stage. So we talk a lot about girls' agency, girls' rights, etc. But there's a real need to engage adolescent boys and young men, right? If we want to get to that gender transformation as allies in gender equality, to support women and girls' agency and bodily autonomy and rights. At the same time, I think what we're not talking enough about is the importance of addressing the specific health and social development needs of adolescent boys and young men themselves, right? And we know that in mid-adolescence, which is between the age of 13 and 17, young boys have tremendous social and peer pressure to conform to normative attitudes. But yet their ability to critically reflect is completely underdeveloped, right? So that is a mix of confusion for them. So it's really important to think about what are the costs of rigid gender norms for young men and adolescent boys. Well, we know in a report that we published with Promundo a few years back, and I think the data is still absolutely relevant, unfortunately. In the Americas, we know that 1 in every 3 deaths among boys aged 15 to 19 is due to interpersonal violence. And what does that mean? It's driven by this masculinity, this hyper-masculinity, etc. We also know that young men under the age of 25 are 3 times more likely than young women to die of a traffic-related injury. Now, of course, because of gender norms, girls have less mobility and the ability to be out there in the world than boys. Boys have more freedom and mobility, but still 3 times is very, very high. So bottom line, the process of questioning and overcoming rigid and violent norms, which is key to gender transformative approaches, really helps women and girls, but it's also very positive for the lives and health of adolescent boys, young men, and future men. And finally, I want to close with comprehensive sexuality education, which is something that UNFPA talks quite a bit about, which is a key area of our mandate, is such an important path to promote positive norms from an early age. Thank goodness there's been a paradigm shift in sexuality education field, which really focuses on moving beyond just the biological and health aspects to try to instill critical thinking skills in young people, right? And the way they think about gender and the way they think about power, relationships, etc. So if that curriculum is really comprehensive, we see that it's an important way to have critical reflections on masculinity that teaches boys equality, fairness, respect, consent, and this is all key for being able to have gender transformation. UNFPA recently published international technical and programmatic guidance for out of school youth, and I'd be happy to share more information about that. I'll close by saying that one critical opportunity we have as an international community, which marks the 25th anniversary of the Beijing Platform for Action, is the Generation Equality Forum, which is hosted by UN Women, France, and Mexico, and there are 6 related action coalitions focusing on different themes. UNFPA is really honored to be co-leading with other partners the Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights. And one of the key priorities under that Action Coalition, and so you can see the link between gender equality, agency, rights, bodily autonomy, is CSE. So comprehensive sexuality education, along with access to rights-based SRH services and addressing gender norms, is one of the key pillars of this Action Coalition. And what we want to do in this Action Coalition is make sure that we increase the access to sexuality education for both in and out of school youth, reaching at least 50 million more children by 2026. So again, it's just a glimpse of some kind of global, let's say, mobilization for addressing gender transformation using bodily autonomy, rights, but focusing in on CSE. So thanks so much, Jose Roberto.
Thank you, Layla, and thank you for introducing us on this dimension of how gender transformative approaches are really able to transform relations, but also starting with the agency. What's the capacity of people or young people in particular to address the agency level, considering that the transformation requires both transforming negative notions of femininity but also masculinity. And all the conversation around when it comes to sexual and reproductive health and rights for young people, what does it mean transforming masculinities from early ages? And it comes to the conversation around the boyhood, how we can really transform or plant the seeds of a more gender equal world from early ages, taking this not only progressive but preventing approach on what we do. So thank you so much, Layla, for and just for keeping us on the loop of how gender transformative approaches should really invest in agency, how people can have power within for them transforming this power for what we do outside, and how the transformation can start, of course, from the individual level, but connecting with systems that you were referring to in your analysis, how we can, transform the gender socialization, and how CSC can be a strategy and approach that can be transformative. And we already also, share with all of you, you can see in the chat box, the out of school guidance for comprehensive sexuality education. Thank you, Layla. Evolving on this conversation, I would like to invite Marten from, ILGA World. Marten is a youth advocate, who has an extensive experience working, across, in different regions and around the world on youth participation, the rights for young people, particularly, for, LGBTQI plus young people. Marten, you started very early, in your 30s, working as an activist. I remember myself, I started when I was 12 as well. How all these, experience can be translated. And thanks for joining us on this conversation today. Marten is part of the Secretariat leading the youth conversation within ILGA and other platforms. He's part of the, high-level commission following the commitments from the Nairobi Summit on ICPD. So Marten, we are really happy, to have you here today and contributing to this conversation. I would like to hear from you, continuing with this conversation around what does addressing gender transformative approaches mean for men and boys, and the work that we are doing or expecting to do in terms of masculinities mean, uh, you know, and particularly to you, we would like to know or hear from you which are the main elements that gender transformative approaches should address from a sexual orientation or gender identity perspective, in particular when it comes to CSC or transformative approaches that could be available. So over to you, Marten.
Thank you so much, and thanks for the introduction as well. I think like the short answer to the question of what does really gender transformative approach mean for young men and boys, I think will be liberating for like everybody. I think that would be the short answer, because of liberating of what we perceive young men and boys to be, to how they behave, how they act, what roles they take in society, is that liberational aspect of it. And then the more you look at it, is that, the important conversation needs to go into how we reframe masculinities, like was mentioned earlier, but we take more personal approach, how everyone defines masculinities in their own ways, and not externally we put the pressure on young people of how they should define masculinities. I think also the conversation needs to expand and to include not only cis young men and boys, cisgender young men, but also trans people as well. And as masculinities are not reserved only for cis young men and boys, they're there for everybody to define and reframe. I think that's an important aspect to look into. And Layla mentioned as well about positive role models, which plays a crucial aspect of this in this conversation, and particularly for queer young people in particular. I think when we talk about masculinities, it's important to see them as well as not this rigid and static, as often we see them structures, but more as fluid. And particularly if we are looking at queer young people growing up as well, understanding that they change and vary, and giving the opportunity to reimagine really what it means for our communities and for everybody. And when it comes to CAC, which is, thanks for like bringing as well how I started my activism, because that's how I started. I started with PA education in school in Bulgaria, and which before I kind of go into that example, I think is important to understand the context as CAC can play for LGBTQ people in their countries. And in order to understand the context, we need to understand the barriers. And there are a wide range of violence and harmful practices queer young people face, from the harmful practices, sterilization requirements, intersex surgeries, conversion therapies, violence against queer young LGBTI women, particularly queer women of color as well. So like a wide range of forms of harmful practices, also like high levels of bullying in schools, increased homelessness, mental health support as well. And also a lot of those queer young people can't access any services, healthcare services, mainstream services, because first they are not either inclusive or they're kind of left out of the provision, and they cannot also access even LGBT services because of restrictive legislations who are over 18, where young people cannot do that as well. So it kind of understanding that concept of like really social, and then CAC, what role can play in, is important, because in a society where everything demonizes you and kind of isolates you, comprehensive sexuality education can play a really crucial role, provide a safe space where you can create a sense of belonging, where you can explore your identity, where you can have a conversation about who you are, and and who you're attracted to, and etc. A place where it can be affirming space, where it can be representative of who you are, and where it can also explore the differences between sex characteristic, gender identity, sexual orientation, and expression, which I think are crucial to separating those constructs and pressure on young people to behave in a certain way, to be a certain way, and to that notion as well. And I think that CAC, it did for me, can play this role of how our identities, expressions, and experiences are protected, are like respected and recognized in a safe space. And because I started doing peer education, and I thought it was really comprehensive, doing interactive sessions and with young people across different communities, including juvenile offenders, Roma communities within back in Bulgaria, and talking about STIs in different areas. But what I was educating and what was sharing with others I couldn't relate to, because it was very heteronormative, and it was very normative, and I was falling into the same trap of important to acknowledge that that actually CAC is comprehensive sexuality education. It's not really comprehensive if it's not LGBTIQ inclusive. And that's really the important aspect, at least from my experience realizing, because when I was going to different centers, I heard from service providers using abusive language towards very homophobic language, where they were supposed to be having that care role in their practice. And that kind of further isolates people who are there in that space and hear it when they're not out, particularly. And I think a final thought would be that I believe, particularly for LGBTIQ young people, or young men and boys in particular, in the conversation of transforming those gender constructs and creating more positive models of masculinities, is to see comprehensive sexuality education as an opportunity to provide an alternative vision in very toxic context of what like their lives can look like as well, and what being able to be yourself in a society that's supportive, affirming, and you have a sense of belonging can look like. And it's often and often that's not the case, but it was in my case. Even though it wasn't LGBT, it provided me with the opportunity to develop and grow in that sense. And yes, and that's from my side, I think.
Thank you, Martin. And just listening to you, I was remembering myself, not only as an educator, but somebody working with the education system, integrating the CSE perspective. And I can tell you, at least from the Latin American, the Caribbean region, all the time when we were, reviewing the state of the art of where the countries were, at or something, very often, the content that was not addressed was around, sexual diversity or identities. And also when, all the negotiations around the, preventing through education ministerial agreement was done, actually the Caribbean countries were really eager pushing back all the conversation because the recognition of the plurality of the or diversity of young people. So I think it's a challenge, but I would like to recover, what you say and connect with what Layla was saying around, the huge importance that really, have the work on, the early stages of, gender socialization for really, addressing transformative approaches. And you started with a keyword. What does it mean for men and boys? And you said, liberating. How very often we are, forgetting the main outcome that we are looking for when we are working on gender or human rights or sexual and reproductive rights, that is really providing the conditions for people, especially young people, to really fulfill their own aspirations, desires, pleasure. And you said, liberating, how your existence can be, restricted, even, for those programs that are aiming to transform. And you said, how these, all the systems, including, the education system, is trying to say how you can behave, how you can be, how you can exist, and how we can, transform this reality that you were talking about in terms of, how we can make sure that comprehensive sexuality educations or the empowerment programs are really able to consider, the identity elements as a critical element in terms of, the development of, our personality, but also as a way to ensure, the fulfillment of human rights and, to address gender equality. So thank you so much, Martin. And I would like to invite everyone, that is attending this conversation, this roundtable. We are aiming to have, this conversation as a collective conversation. So please use the chat box if you want to say something, if you have a reflection, if you are listening and saying, no, this is not happening in my country. You are reflecting something that maybe is happening in your region, but not necessarily in my context. What is going on in your context? We would like also to hear from you. We have limitations of time all the time on these conversations, but we really want to hear from you. So use the chat box if you have something to say, some experience to share, something that you have done in the past, what does it mean, gender transformative approaches for you in your country? And I can see that, in Algeria, UNFPA has been advocating for implication of men and boys in GBV prevention. And they are also conducting, qualitative studies on men and masculinities with Promundo. Thank you so much. Yes, please share it. This is a space for sharing, and collective learning and thinking, because transformation requires that everyone is involved. So thank you so much again, Marten and Layla, for this first section, and how gender transformative approaches are also, completely, interrelated, intertwined with, bodily autonomy and other dimensions of uh, gender equality. I would like to invite now, our next speaker, that is Marten Kivi from the Gender and Human Rights branch from the technical division of UNFPA. Marten has, also an important and extensive, experience working in public health, in gender, and how the social determinants can be also, provide transformative elements, when it comes to men and voice. And Marten is leading the conversation around masculinities, in technical division. So we would like to hear from you, Marten, following these, collective questions around, what gender transformation means for men and boys, and how the programs can really address what is needed, and what does gender transformative approaches and partnering with men and boys means in relation to sexual and reproductive health and rights, but particularly around decision making and bodily autonomy. And we know that there are different approaches for, partnering on or engaging with men and boys, and we would like to hear from you. So welcome, Marten. Over to you.
Thank you very much, Jose Roberto, and thank you very much to Men Engage Alliance for providing this platform for having these important discussions. And so I've been asked to talk about SRHR decision-making and bodily autonomy. And this is a very timely topic because yesterday, UNFPA launched its annual flagship publication, The State of World Population, or SWOP, as it's also called. And this year, this report focuses on bodily autonomy and decision-making on SRHR. And this is actually the first time that a UN report focuses on bodily autonomy. And bodily autonomy is about the right to make decisions over one's life and future. And not only is bodily autonomy a human right, it's actually the foundation upon which other human rights are built. And the SWOP report this year builds on data that UNFPA published last year on 2 indicators for SDG target 5.6, for which UNFPA is the custodian agency. And the first indicator looks specifically at SRHR decision-making. And the indicator considers 3 decision-making components. It looks at seeking healthcare, use of contraception, and intercourse with partners or husbands. And what we see from the data is that only 55% of women are able to make their own decisions in all 3 dimensions of bodily autonomy. And this is, of course, bad. And the COVID pandemic now has introduced even more challenges. And there are also many issues regarding bodily autonomy that are not covered by this indicator. I'm thinking, for example, of child marriage, female genital mutilation, marital rape, and virginity testing. And the second SDG indicator measures laws and regulations that either protect or deny bodily autonomy. And that second indicator tracks 4 topics, and that's maternity care, comprehensive sexuality education, contraception and family planning, and sexual health and well-being. And previously we heard from Marten and Layla about the importance of comprehensive sexuality education. And unfortunately, what the data shows us is that that is the section that is the weakest in terms of supporting laws and regulations. Only about 56% of countries have laws and policies that support CSE. And when looking at this second indicator, it's also important to recognize that the indicator measures the presence of laws and regulations. But as we all know, it's the implementation of the laws and regulations that really matters. So the indicator data that I just described illustrate the lack of bodily autonomy and supported laws and regulations for many people worldwide. And this is, of course, detrimental for women's and girls' SRHR, but it also has broader negative consequences on their education, on their income, and on societies as a whole. So what can be done to improve the situation? So access to sexual and reproductive health services and information is fundamental to support the bodily autonomy and decision-making on SRHR. But having these SRHR services in place is not sufficient. Real access also depends on women's and girls' empowerment, and achieving bodily autonomy relies on gender equality. And we can find determinants of women's decision-making at different levels. I'm thinking of individual level, in the personal level, in the community, in the health systems, and among socioeconomic factors. And there are several things that are essential to upholding bodily autonomy. Education, as mentioned before, is key. Social norms must become more gender equitable. And health providers also have a crucial role to play in ensuring bodily autonomy of those seeking information and care. And also, as I touched upon earlier, laws have a significant impact on women's rights, gender equality, and SRHR. And there's also a need for reliable, disaggregated, and complete data to track progress. And we also need to consider intersectionality and that certain groups are left behind. So the picture I painted in the beginning now is quite grim, but there's also progress. We can see, for example, in the UNFPA programming that there's a lot of good work being done with adolescents and youth. And that work is sometimes gender transformative. It addresses and challenges gender inequalities. Sometimes those aspects can be improved, but at least there is a good foundation to build upon to develop programming. We have also seen that Tunisia has passed a GBV law that has included the explicit criminalization of marital rape. We saw that Botswana has decriminalized same-sex consensual acts among consenting adults. And there are also a number of good examples of gender transformative interventions developed by civil society partners, such as Promundo's program H&M and the SASA approach developed by Raising Voices. So although many impediments to bodily autonomy, gender equality is perhaps the most apparent one. So I'd like to dig a bit deeper into that in gender transformative approaches. Because real and sustained progress depends on uprooting gender inequalities and transforming the social and economic structures that maintain discrimination. And in this regard, gender transformative approaches is key. And this relies on the engagement of both men and women. And the title of this session asks what gender transformative approaches means for men and boys. And I'd say it means that more men must become allies. Men need to step away from patterns that preserve patriarchy, and men need to uphold an environment that empower women and girls. And when talking about gender equality, we should also recognize that men need to take on their share of unpaid care work and reproductive labor. And also, as Layla alluded to before, gender equality is a win-win situation. Men would also benefit from improved gender equality. And these gains include lower mortality rates and reduced risks of depression and violent death. And there is some evidence of what works in gender transformative programming. And I believe, or I posted some of those studies in the chat box before. But the literature also indicates that gender transformative approaches are often not used when engaging men and boys in SRHR. So there's a large room here for improvement. And what the literature also shows us is that there's a need for more high quality research to support evidence-based programming using gender transformative approaches. So to conclude, bodily autonomy and decision-making on SRHR is a human right that is often unfulfilled. SRHR and gender equality are intrinsically linked, and there's a need for structural and systemic changes to achieve gender equality. And gender transformative approaches, in partnership with men and boys and accountable to women and girls, will be essential in the work moving forward. So I think I'll stop there and hand over to you again, Jose Roberto. Thank you.
Thank you, Martin, so much for bringing, this perspective around, how the work on masculinities is completely, intertwined with the whole notion of bodily autonomy, which is not necessarily a new conversation from a feminist perspective, but could be new for the development, field. So it's a quite important conversation. We encourage all of you to review the State of the World Population Report, and we can share it, in the chat box as well. And we are, I invite you to read also, the comments in the chat box. We are getting, different, experiences, for instance, from Algeria, but also, some conversation in terms of, how sensitive the context could be and what they are doing, how, and they are recovering also, some notions around, this diversity element that we have to consider when we are working on masculinities, because that's why we call masculinities in plural, trying to also overcome this notion of there is only one way to be, a man or men in societies, that very often is, using, harmful masculinities perspectives for, hegemonic masculinities. And Martin, you were bringing to us, this element, this key piece of gender transformative approaches, that is, all the element around decision making. And decision making is completely, interrelated to your capacity, your capabilities, your power, your knowledge, the conditions that are there for you in terms of decision making. And also we need, of course, power for women's decision making, but also the engagement of men, involved in decision making and co-responsibility process, care, and so on. So thank you so much, Martin, and also for flagging the gaps in terms of research and keeping in mind these element, the key element around decision making, the challenges, but also the opportunities, and how the programs can really promote decision making and a more equal and negotiated decision making. I would like to also connect your conversation with the need of, how the health services, and particularly sexual and reproductive health services, can provide a space for real decision making, or meaningful decision making for people, for women, for men, and especially for young people. So I would like to invite now Petra, who is, our colleague from the Sexual and Reproductive Health branch in the technical division of UNFPA, Petra Tenhofer. She's, a technical advisor on sexual and reproductive health. Petra is a Dutch midwife who has been working in the field of, midwifery, supporting health systems. She's the former, president of the International Confederation of Midwives, and Petra is working very closely with the health systems, informing, what we can do in terms of, addressing transformation through the health system, and how the health force can be also addressing transformative approaches. So Petra, continuing this conversation with this overarching question around what does addressing gender transformative approaches mean for men and boys or masculinities, going to a particular question for you would be, what does gender transformative approaches and partnering with men and boys mean in relation to sexual and reproductive health services? We would like to hear from you, Petra. So over to you.
Thank you very much, Jose Roberto, and thank you everybody for joining this call. So I am indeed a midwife, and for that reason, I'm going to just take you to the basics of the health system. I'm actually going to take you into the delivery room. And I'm going to talk to you about what some of my experiences were when I was a midwife in Rotterdam. And I worked in a part of Rotterdam where there were many, many people from other countries. In the case of the Netherlands, often from Morocco and Tunisia. And we had many issues with regard to masculinity, with regard to autonomy, and with regard to being able to kind of balance what the need is for the health system in order for women and families to be safe, and what the kind of religious and other characteristics are of the societies where they came from, and how that had to be safe as well. So in the Netherlands, there is a practice of also being allowed to give birth at home, and that is supported by midwives, and I've done many home births in my professional life as a midwife. One of which was with a Moroccan family who were living in a small house, but with many, many people. So in that house were not only the young woman giving birth and her partner, but also the parents and the grandparents. And as is tradition, decisions for a referral to a hospital or decisions to make a change in what was expected with regard to care provision need to be sanctioned by the oldest person in the house. So there I was going up the stairs to find a man with a stick in his hand, sitting in a kind of a throne or a tall chair, to whom I had to explain what the issue was, why I wanted to go, and ask for his permission. And that was, for me, an extremely shocking experience, because my background from the Netherlands is that this happens in collegial collaboration, discussion. It's things we've discussed with people before they go, before women go into labor. And I never realized that that could be so different in other cultures. So what actually was so beautiful after what happened afterwards, when the woman was able to go to hospital, she had a safe delivery, and the grandfather, who otherwise would never have really kind of left the house or done anything specific, came to the hospital to visit his great grandchild. And that was an opportunity, and there were several, not only for him but for other men in that household, to understand not only how this can be safe and how it can be focused on women and girls being pregnant and giving birth, but also the role that's important for men to take in this, not only in decision making, but also in supporting, in finding resources to make these things possible for women and their families. So the way forward in some of the ways in the things that we then did as a midwifery practice, we were 4 midwives, is we started doing information sessions, not only with regard to for women, but we actually asked them to bring their men in, and we also asked them to bring in the decision-making male in their household, so that there would be much more understanding of how things work in a country that was also still oftentimes so very strange to them. So this kind of also helped us find ways in which we could bring men much more into the whole process along pregnancy and childbirth, including they themselves saying, we would actually like to be there. We would actually like to support our wife or our daughter in the activities and things that have to happen around pregnancy and childbirth. And that to me, in kind of thinking about the things I've heard from the previous speakers, is something that might be useful to include in the kind of work we're all doing, so that the reality of what life is like can also kind of help people change the way they see things. One of the other things that are that work really well at the moment in several countries, and that actually strengthen enormously the access to sexual reproductive health and to facilities, is women's groups, not as women's groups as in defined or discussed in but previously, but specifically focusing on group antenatal care. And that is a form of care in which women come together in a group, they know each other, they're in the same gestational age, and they actually walk through pregnancy together with the support of 2 midwives. The session that they come to is usually about 2 hours. It starts with a topic that everybody needs to know about and is discussed. And then as there are questions and answers, the women one by one go with one of the midwives for a normal checkup. In the meantime, the others weigh each other, take blood pressure, talk about the things that are happening. And some of these groups have also started bringing in men to those sessions, which are usually kind of mysterious, and they don't quite know where they're going. They don't quite know what it means. So actually being able to participate in something like that, not just the one session that is for the men, but any session they would like to come into, really makes it much more a part of normal life, makes the child that's going to come into their lives much more recognizable once it does, and gives them the opportunity to realize that the father role is as important as the mother role in the situation of being a family. Now, I know that this story, or what I'm talking about, could be quite far away from the kinds of things that you're dealing with when you talk about gender identity and autonomy and making sure that women are safe, and that there is an opportunity for everybody to get to the place they want to get to in life. But sometimes taking that granularity a little bit lower gives or kind of more to the day-to-day of life might be helpful for people and for families and communities to really get a bit of a grasp on there are parts of this that are very, very normal elements of life that we all go through and that we all learn from. So I'll leave it there. I'm happy to take questions or to discuss more when we get to the next stage of our session. Thank you.
Thank you, Petra. And, just listening to you, it reminds me, all this conversation around that very often, there are many biases in terms of when we are working on masculinities. One is, okay, when we talk about masculinities is, they are the problem. And they are, men are always in opposition to gender equality, or just, around the harmful notions of gender. And we can, forget that gender is relational. Of course, it's structural, but also, it's based in, the whole relational system in society. And your conversation were, providing this element about how gender transformative approaches, when it comes to the health system or the health services, are so close to the, quotidian life of people, and how, these health workers are also coming with all this bag of beliefs, feelings, culture, and etc., and how the transformative approaches should be speaking around these particular areas that are the closest to the life of people, in terms of really making accessible, compelling, appealing to what they are living. And you mentioned also this critical area that is participation, and how we can translate participation, taking different dimensions, how we really need to include health workers, for instance, in conversation around gender equality, to recognize that decision making is critical for women, but also men have something to say when it comes to their health or family health, and also when it comes to reproductive rights. And there is a big question mark around the world. What's the limit of the reproductive rights for men? and how the knowledge can be translated into sensitization and transformation. And thank you so much for bringing this element of the quotidian element of transforming norms, beliefs, but also systems. So thank you so much, Petra. And I would like to recover not only your conversation around this example that you were providing, but also what Martin was saying around decision making and how everything is connected. So I would like to hear now from Pamela, who will be, providing the other perspective from Chile around the conversation on how gender is really, important when it comes to the education system as a whole, and not only on comprehensive sexuality education, but what does it mean addressing gender transformative approaches, in systems? Because, gender transformation requires that we are working to provide, a shared distribution of power and resources, and we know that this is done through systems across the different levels of the ecosystem. Pamela Saavedra is, the vice president of Cultura Salud, M, from Chile. She's also part of different streams of, research around gender masculinities within the University of Chile. She's former co-coordinator of men engaged in Latin America and the Caribbean, and you are working with young people and, through different, platforms and streams. We are very happy to have you here, Pamela. So we would like to hear from you, and, particularly in terms of, how would gender transformative approaches look like in the education system? And I would like to also recognize, the people that are the participants that are contributing with examples, reflections in the chat box. So we really want to keep, listening to you and create this conversation a collective space. So over to you, Pamela.
Thank you so much. Thank you for having me. Well, as you were saying, I'm going to try to talk about the educational system. And when I started thinking about this, I started thinking about all the manifestations and the protests that we had here in Chile, for the 10 years now. Yeah, we kind of started with this huge student movement in 2011. And the student protests, they demanded better conditions in schools, in the universities, and an equal access to university. That's a huge thing for us because, as you know, Chile is a poor country, but with this wealth mine. So we think that we have a lot of money, but we don't. So that's how we treat people. And that means that we have this huge difference between who can access to university. And that's a huge problem for us because we have this whole universal access in schools, but then when we comes to go to college, it makes a difference. So going back to 2011, we have this huge student movement protest demanding equal access to universities and to education, and demanding a better quality of the education. Because, as you know, when you have the money, you can have a good education. And when you don't have the money, you kind of have really poor education. And well, then in 2018, it becomes, the demand becomes more, how you say it? I don't know. I'm going to put it it becomes like a female and feminist demand around harassment in universities and schools, and demanding that not sexist education. And that was a huge feminist movement goal. And we have around 30 universities closed, and where the women took the places and shut it down. So it was I don't know, 3 months that they paralyzed the whole university system. It was huge. So, well, when they demanded the non-sexy education, it becomes like a huge problem, like a huge issue for men, that they were like the visible face of the student protest. And then they didn't have this power to demand, like, to be there, and they wanted to be there with all the cameras and all the speeches, and the women say, no, enough is enough. This is our place now. This is our time to say, stop, we don't want you here. And that make some group of men try to work this together, and they started to create these circles of study circles. I don't know if we were all study, but conversational circles around these issues, around their issues. And they become, some of them, like an institution. They become like these assemblies, non-patriarchal assemblies. This is a huge group here in Chile. And they started creating their own agenda. And that's huge. Like, if you think how much we have changed in these 10 years now, it's really relevant. Yeah, we do need a lot of work to do, but we have this kind of highlights, like hope highlights, that we need to stick to. And then we had the big protest in 2019, the social riots that happened here in Chile after October 2019. And why this is important, keeping in mind the gender transformative approaches, because they were led by young people. And they started with these school boys and girls that said, yeah, enough is enough. I'm going to do this not only for ourselves, but for my fathers, my mothers, my grandfathers, and my grandparents, and everything. And that's really important, because you were saying, I really don't remember who, but you were saying the importance of young people in this gender approach, the gender transformative approaches. And I think it's huge how the younger generation is doing an amazing work here, like taking the lead of this social movement, the social transformative, and yeah, and that's it. That's one part of the problem, that we have these young people like fighting against the system, but we do have the other part of the system that is really tough to change. And we conducted an investigation when we wanted to know what is happening inside the classroom, because also, like you said really well, teachers here, well, everyone in the education and health system and all the systems have their own narratives and beliefs. So we wanted to know how that was put on the classroom, like how that it's really important, because you are teaching children to behave in the world, and those narratives goes through you and puts on the children. So we wanted to find the gender biases in the classroom, and we took some videos of classes that here in Chile is mandatory to have the evaluation for the teachers all years. So we took those videos and we watched a lot of videos, and we kind of started watching what the interventions and how they can mold their classes around gender stereotypes. And what we found is that 60% of the kindergarten teachers were quite putting their gender stereotypes. They only, in the indicator that we have, 60% were in the chat in the box basic. They were only basic, and we had like 4 categories, and they were 60% were basic, and the rest of them weren't doing any better. I think that the only ones that do kind of better were the were the special educators, the ones who working with special needs students. So what I'm trying to say about around all of this is that we have these 2 big worlds like facing each other, and we need to create these re-educational spaces, and they are kind of doing this. But I'm going to take some of what you say. The agency is really important, because here in Chile we don't have sex education. Less and the only way that boys are having sex education is through their own agency. They started creating these groups to talk about sex education and to talk about their issues. So these all male spaces are really important, because they feel free to speak up, and they feel free to speak and to create a new ways to relate to each other and to women, and yeah, and so this creates two kinds of things, because one of them is an invitation to action, to have these spaces to talk about their issues. It's an invitation to take action, but also they have the excuse to maintain their power, because they are saying, yeah, we're cool, we're checking about ourselves, we're checking about, like, we are super feminist, and so that's a huge thing now. That's what we're studying now, how to separate this kind of I don't know how to say it, because it's kind of tricky how that works, because it's a way to maintain power, to say that we are super feminist now. So yeah, in the education system, we're trying to create some approach, so gender transformative approaches. Well, we have to change the narratives in a really conservative country. So it's a big challenge that we have now. But the hope is that the youngest generation are doing a lot of work here. So yeah, I'm going to shut up now. Thank you for your time.
Thank you, Pamela. Thank you for sharing these, powerful, elements around, what has been happening in Chile. And I will really, I really want to recover what you say in terms of how all these changes in terms of, gender transformative approaches are not necessarily coming all the time from top down, right? From the systems to societies, are actually a demand coming from the people, from young people, challenging the system, saying this system is not necessarily, reflecting or responding to our needs, and we have to change the system. So I really, appreciate what you were saying in terms of, how social movements, particularly, young people, feminist movements are really, challenging the system, and particularly the education system in Chile, to recognize not only the gender stereotypes, but all the problem around, the lack of access to the right to education, and how social movements are really driving this agenda of, transforming the system. And you mentioned something that is also critical, how we can, after this demand and demonstrations and protests asking for a change, can be translated in some dialogues that can, make some real changes in the classroom. And you provided this example of, how changing gender stereotypes and how having indicators, measurement in terms of this change can be really, really transformative. And you said also that, how we can, provide these single, gender, spaces to be translated in something that can be, actionable, and how, transformation can really speak to the movements. So thank you so much, Pamela, for also, showcasing how young people and youth movements and feminist movements are really challenging the system, a system like the education system that is really shaping, not only the narratives, but behaviors and beliefs, the existence, as Marten was saying previously. So thank you so much, Pamela, for sharing the experience of Chile and what MS Salud is doing. So continuing with this conversation, and we have a question and a comment in the chat that is saying, from Marten, it seems that, there is a significant potential of gender transformative approaches in the pregnancy and childbirth birthing process for engaging that in gender transformative interventions. I would be interested to hear more about it. And I think this is something that our next speaker, Marcos Nascimento from Pio Cruz, Brazil. Marcos is, is a public health researcher and activist from Brazil. He's the former, deputy executive director of Promundo, in the early ages of Promundo in Brazil, and now he's leading the research of, around gender, health, and masculinities in Fiocruz. And you are closely working, Marcos, with the Ministry of Health, reviewing what has been done during the last decade around the healthcare policy for men in Brazil, one of the few countries that can really, share the experience on a national policy focusing on engaging men in health, and how, this can be transformative. So Marcus, following up on this conversation on what does addressing gender transformative approaches mean for men and boys or masculinities, I would like to ask you directly, what are the gaps and opportunities regarding formal policies, legislation, systems, and institutions to enhance, gender transformative programming, but particularly in relation to SRHR decision making and bodily autonomy, taking into consideration directly the experience of this national health care policy for men in Brazil. So over to you, Marcos.
Thank you, Jose Roberto. Well, it's very nice to be here, to be part of this panel. I think we need to have some steps back in terms of a learning process of how to engage men and masculinities into the health sector here in Brazil. Since like 20 years ago, when we launched the program H and program M here in Brazil in a regional conference in 2002. It was one of the first experiences bringing together different players, Promundo, Papai, ECHOS, and other colleagues from the Latin American region, as well as UN agencies, to reflect about how to include men and masculinities in public policies, not only in small projects or small initiatives or community initiatives. We recognized that it was important, but not sufficient in terms of how to achieve gender equality and promote health among men. And we had a very successful experience here in Brazil before the national policy for healthcare to men, particularly regarding to adolescent boys and young men. How to bring together Minister of Health, Minister of Education. He started a health in schools project around the country. That national policy for healthcare to men has a very interesting history, that brought together different players, medical associations, civil society organizations, academia, and other movements to discuss how to address men and masculinities in terms of health policy and why we need a specific policy target to men. It was like 2 or 3 years of discussions, and in 2009, during the Lula, it was the first government of Lula, we launched this policy, as you said, one of the few countries in the world that has a specific policy to men, based on some pillars of work. One of them is fatherhood and caregiving, and I was totally attached to what Petra said in terms of the father's role and mother's role, and how important it is to bring men since the beginning in terms of the medical appointments to the delivery room. And we developed many different strategies in the country, but as you know, Brazil is a large country with different when the social inequalities among the regions. So it's much more something that happened in the urban areas than the rural areas, much more in the south of the country than the north of the country. It was very interesting to challenging the health services about how health providers, how about the organizations of health system see men and masculinities. So the absence of men was natural. So men, they don't come to health services. And we have to deconstruct this idea that it was natural, but to identify the social and cultural barriers to bring men to the health clinics or the health system. So it was a step by step in terms of a huge learning process. And I think this strong collaboration between academia, civil society, and policymakers were very successful in terms to address not only men's perspectives around what means health. Most of them, they don't recognize the clinical spaces as a man space. It's a female space, with the posters, with the pamphlets, with the materials. All staff are female. It's not a space for me. And we have to, step by step, deconstructing this idea and showing other possibilities of engaging men. And particularly in the topic of fatherhood, I think is one of the most important topics in terms of our policy here, is to not only in terms of engaging them in the health system, but also in deconstruct some gender norms around care work. And I think it's one of the key issues as well. Care work and the care economy is probably much more common in terms of the female population than the men's and masculinities approach. So how can we socialize boys and socialize men to recognize care work as a work for men as well? Another important topic that you mentioned and someone in the chat mentioned as well is GBV, it's gender-based violence. And other important topic of the policy and how to engage men in GBV prevention. And I think it's one of the most important topics in terms of to bring together not only health sector, but other political aspects, trying to involve education, trying to involve women's affairs, trying to involve social justice, human rights, social development. One of the most important cause of death here in Brazil is violence. And I'm not talking about the gender-based violence, but talking about the urban violence and the state violence about specific group of men in Brazil, particularly the poor, young, and Black men here in Brazil. So the policy is very ambitious in terms of bring together different issues, and each one is very important. But particularly, I'm very connected with the discussion on fatherhood and discussions of violence. And discussions of gender-based violence has been very well known in Brazil since our domestic violence law in 2006 that bring this recognition that the man is part of the problem. They must be part of the solution, and we need to develop some strategies or some specific programs to engage men in critical reflection about gender-based violence. And I think, just to finish, the pandemic of COVID-19 highlight some important aspects and challenging us in terms of the social inequalities here in Brazil. The pandemic affected all of us in Brazil, but mainly the poor population. And I think this is one of the important aspects to bring this notion of intersectionality to analyze the pandemic of COVID-19 around the globe, but specifically in Brazil, as well as we are dealing now, not only in Brazil, but other countries in Latin America, know this anti-gender campaigns, the crusade of anti-rights, and it affected the healthy policies here in Brazil. When we have a president that they say, oh, it's just a flu, you don't need to be worried about that, or use masks is not for real men, so real men don't have to use masks. It is a strong message that affected all health issues that we are dealing with right now. We are one of the few countries in the world with the high levels of death because of the pandemic. And particularly in the case of Brazil, men are dying by COVID-19. So we have to keep in mind that this gender transformative approach is crucial, not only for every man in the country, but also in terms of our politicians and our public policies around this important issue that affected all of us.
Thank you, Marcos, and thank you for bringing us, back to this conversation around, what are the foundational programs that led to building this policy around health for men in Brazil. Ruth is asking if there is a copy of the men's health policy, if you can share, Marcos. I know there are some articles about it, and we know that you are under the process of reviewing the progress of the policy after a decade or more in Brazil. And we would like to hear next time maybe the learnings from that policy in concrete terms, especially considering that Brazil is a huge country, it's a subcontinental country in the Americas. And thank you so much. And you mentioned that how critical is the work on the policy level, especially if we want to scale up programming and transforming also the way we understand health. And you mentioned something that also is referring to what Pamela said in terms of the education system. And is, this is a female issue, right? Sexual harassment is a female issue. They are demanding. It's a feminist issue. And now, the services are, female, or for children or for women, but not necessarily really creating the conditions for men to to take care of their health. And you mentioned the key topics that this policy has been addressing: the sexual and reproductive health, the engagement and participation around the reproductive care, but also fatherhood, caregiving, all the reproductive labor which is critical for distribution of resources, and also the burden and the prevention and response to gender-based violence. And also considering the nuances, what is going on in terms right now of the pandemic, and how these gender, dimensions are really shaping the capacity to respond and be cognizant of others' health and so on. So thank you so much, Marcos, for bringing us, this level of the policy elements, because this conversation, how we can talk about gender transformative approaches if we are not considering the different dimensions across the ecosystem. Of course, it's important to change the narrative, as we have been saying, but also transforming the structures that can be able to redistribute power and resources. And thank you so much for those who are, and Petra is also, sharing some resources in the chat box. Thank you, Petra, for that, and also Marcos. And for closing this collective thinking, I would like to invite now, each panelist, started with Layla to just conclude with one, thought about what are the next concrete steps we can take towards realizing gender transformative approaches in the work on masculinities, considering your own reflections today, but also reacting to what has been said collectively. So over to you, Layla.
Thank you so much, Jose Roberto, and it's really been a pleasure to listen to my co-panelists. I think, if there's one thing that I would really ask everyone to take away from this session is to really think about gender transformative change happening on multiple levels. And I often see in our programming, whether it's UNFPA or others, this immense focus on the individual level. And I think that individual change is absolutely essential. But as Jose Roberto and others have illustrated, including Pamela, about the systems and the education system and so forth, that a person in her or his ability to change is often sometimes limited by the environment that they're living in, right? So their interface with their community, with their school, with their institutions, with the laws and policies they're living under, and the social norms that dictate their lives is enormous. So change happens at the individual, but also has to happen at the structural level. So that's one key message as kind of a recap. We also need to recognize that there is not simply impossible to talk about one way of having a gender transformative approach. It's simply impossible to speak of one gender transformative approach, right? Gender 101 is context. So, you apply that here too. You have to think about the environment and incremental steps in the same way we talk about progressive realization of human rights. So it's really critical that that analysis is done from the outset. So one of the key things that we find in gender programming is that more operational research is needed to improve programs. And that means looking at the context very closely as you're implementing programs and being nimble and agile and adjusting. And for that, you need operational research. So more operational research to inform what those different multitude of gender transformative approaches can look like and be successful at. And finally, I just want to say that there are really emerging programs or pockets of change that we're seeing. And I want to just mention Promundo's Manhood 2.0, which has been starting off in the US, but builds off of Program H, which has been implemented in many countries. Our own UNFPA offices throughout West and Central Africa have started a program called the Future Husband School, which is a play off of the husband school, École de Marie, throughout the region. And it really emphasizes, again, going back to my point, both of those programs, the Manhood 2.0 and the Future Husbands, to my point in my presentation about the emphasis on young men and really capturing that imagination when gender norms are starting to crystallize. So those would just be my closing words. Thanks so much.
Thank you, Layla. I would like to invite, Marten Karatsov right now. Your key next concrete steps, from your reflection, Marten.
Yes, I mean, it's more building upon what was said by Layla, really, and I think what as well was said about COVID. I think from our work, recently, but just in general, working in youth communities and human rights organizations, we've seen that obviously attacks, whether they're gender-based attacks, whether sexist attacks, whether they're transphobia, whether they are on reproductive rights, homophobia, they go hand in hand, and they come through usually the same actors. But us not addressing one is enabling the other. And we need to start addressing really the core of where those attacks are coming, but the issues that are rising to those. And we need to, our resistance and the backlash we're facing is really comprehensive in the attacks. And we need to be more comprehensive in our resistance. And we need to be able to be truly intersectional, work across sectors and fields. For example, the reproductive SRHR work needs to work more with the LGBTI movement and close those gaps. As we are seeing is that whilst we're not doing that, we are in a way enabling more opportunities for attacks on our communities across the field. And to do that, we really need to start thinking about moving beyond, in our works as well, into the beyond the binary language and the heterosis normative work that often can be exclusionary. And we need to also look into how meaningfully involve all young people, including queer young people, into the design and implementation of the programs around masculinities and young male voice that will really impact them as well. And on the CAC aspect as well that was mentioned earlier, is that understanding the comprehensive sexuality education is only truly comprehensive when it's properly LGBTI inclusive and it's safe, gender affirming, and it has a role beyond the sex education for opportunity to create a sense of belonging. And I think for us to be able to achieve what we've set up ambitiously as in the human rights field, to achieve whether it's the ICPD program of action, whether it's the SDGs, or whether it's Generational Equality Forum, what is said to it, we need to really think of this transformation approaches, like what was said, on personal level, but also to be able to include everyone, especially those particularly marginalized, and put them on the front seat, leading the conversation, so we can liberate really everyone from the constructs that are set externally on us and put pressure on.
Thank you, Marten. I will give you liberating, element towards. Marten, can you tell us, about what are your thoughts in terms of next concrete steps towards, realizing gender transformative approaches?
Sure. Thank you, Jose Roberto. So I'd like to build on what was mentioned before regarding operational research, because that was mentioned. But I would also like to add that we, in order we need to think about sustainability and the measurement of results. We need to be able to show what impact these gender transformative approaches make in the lives of women and girls. So that is one thing, and I think we need to spend more attention on in the future: measurement of results. How do we show that what we're doing is effective? And also, a second takeaway is that gender equality concerns everyone, and there's something everyone could do. And when we work with the SRHR, as we do in UNFPA, together with a range of partners, we also always need to ask ourselves the question: what can we do in terms of promoting better gender equality? And actually, SRHR presents fantastic opportunities for integration of gender transformative approaches. It's a very engaging topic, and we reach a lot of people. So that's a great opportunity that we need to exploit in also achieving more gender justice. And the third point I'd like to raise as regards the next steps is regarding the outcome of the Ubuntu Symposium, because during the past months, there have been lots of insightful conversation and resources have been shared, and it's been really a fantastic couple of months in that sense. And I think it is also all of our responsibility to make sure that we take these conversations and findings that we made together and bring them out to other people that do not partake in these discussions, so that we bring these discussions to a wider audience and make it concrete and translate it into real change on the ground. Thank you.
Thank you, Marten. Petra, we would like to hear from you.
Thanks, Jose Roberto. So thank you for the opportunities to speak one more time. So I think I just have to continue my plea for the health system and the health workforce. There are so many opportunities to link in the programs that you've all been discussing. And as I said, this is a relatively new area to me. So I was really interested in hearing everything that's going on and kind of take it from a very neutral level, not say it has to focus on men, not say it has to change men's behavior, but really take it from a human level as people come into the health system and interact with the health workforce when they are in a difficult position, usually because they're sick, specifically now with COVID, everything is scary, everything is unknown. So take it as an opportunity, both for healthcare providers and systems, as for people who go there and, for example, general practitioners who send them to the health system to learn, to kind of see it as a collaboration rather than as they know everything, they're going to cut something out of me, and not, instead of saying, I'm looking for care and I'm looking for help. And these are people who have learned and who've been trained to provide that for me. Thanks.
Thank you, Petra. And we will keep, this humanistic approach along the way. Pamela, what you would like to say?
Yeah, thank you.
Of the next steps.
Yeah, I was thinking about what I agree with all of you, but I was thinking about how we stop thinking that these issues are women issues, but are social issues that, like Petra said, like humanistic approach. And I think that that's important, but also like we have this big challenge, as Marten was saying, that how we can go beyond the binary. Like that's a thing that here in Chile, I think in Latin America is like ages away for us to think, like for us to address. So how we can go beyond the binary. And I think it's important to realize that boys, girls, and youth in general have this voice and they are using it. They are speaking out, and they are inviting us to think that other ways of relations and other ways to relate are possible. And I think that's important to think and how we can address these issues, and how we can transform the educational system, the health system, the social system in general. Like we have to think that there are new ways to relate with each other. They are possible. And as Marten was saying, that I think that's really important, that we have to create evidence that in order to push policymakers to address these social issues. And I think that if we start to create evidence with this gender perspective, it's going to do a huge transformative way to see things. And I hope that that's going to happen. So yeah, I was thinking these are like these thoughts that I have in mind. Thank you all.
Thank you, Pamela. And I can see that, also Shefa is sharing, in the chat box that there is a great opportunity through the health systems to lower stigma and increase accessibility for all. How all this interconnectivity is really, providing platforms for change, for transformation. So Marcos, we would like to hear, from you for closing, this collective thinking about what are your takeaway, your next steps that you envision coming from this collective conversation? Over to you.
Thank you, Jose Roberto. We are just finishing a study analyzing 10 years of the implementation of the healthcare policy for men to men in Brazil. And I think one of the major aspects, not only in terms of a gender transformative approach, but how can we address this in intersectional perspective, in terms of we need to take into account not a generic man, but including discussions around race, ethnicity, class, sexual orientation, gender identity, age, disabilities. I think is one of the major lessons that we have learned here, and how to address this in terms of the public policies. We need to engage different sectors, and it's not easy, as you can imagine, but I think it's crucial in terms of bring together not only different perspectives, but also different contexts. So we need to engage educational sectors, social development, women's affairs, and other health, other public sectors. And I think at least not only for young people, but how can we take into advantage of this social medias in terms to promote gender equality, to promote health. And I think we have seen this over the last 5 years, at least here in Brazil, how the use of social medias and all internet related medias has an important role for young people, not only for young people, but I think it's something that we need to take into account and take advantage of this in a very strategic and good way.
Thank you, Marcos. Thanks for sharing, the learnings from Brazil that actually can inform, other countries with this grounded, implementation experience. So just recapping, I don't want to repeat, but I would like to highlight, some elements that you brought about, and along this conversation. And I would like to say from this roundtable, and I would like to also, thank all of you who have been including your thoughts, your experiences, sharing knowledge, products, evidence, etc. In the chat box is like we can create this collective conversation, learning from each other and from different angles and from different levels. So when it comes to talking about gender transformative approaches, I would like to recover Layla's point about, considering approaches in plural as we have to approach masculinities in plural for considering not only the diversity, but the intersectional needs and rights that are needed to be, taken into account. How we can work through the ecosystem, of course, from, the individual level, community level, systems, policies. How we can start, with this transformation at early, ages, with, early gender socialization uh, platforms, initiatives, etc. How we can continue in, addressing the root causes of gender inequality, and also considering that there are, counter movements against gender equality, and also considering the engagement of men and boys working on masculinities, also in defending this agenda that is completely linked to the human rights um, field. How we can be truly intersectional, Martin said, how we can make inclusion, as a key element to avoid, invisibilization through programming. How we can, this meaningful inclusion can, address different forms of masculinities that are also linked to the capacity to promote sustainability and measurement, towards gender justice that appeals to redistribution of resources and power. How this humanistic approach that Petra was saying and talking about is also connected with this conversation around, what Pamela was saying, and Martin were saying around, the existence to be, the possibility to exist and to fulfill your personality, your desires, yourself. How we can stop, thinking in silos, beyond the binary and binarisms. How we can expand, the conscience, to help providers, educators. How we can transform systems, but also considering the norms that are informal. How we can, work with social movements how we can, keep with this humanistic approach hope as an element that can drive what we are doing and expect that transformation is possible. And how we can avoid, considering that men are just equal, or, they are just a generic group, and how we can really address intersectional and multisectoral approaches, and how we can, also leverage on social media and the digital space for this transformation. I know that there is much more to discuss about. There are many angles. There are, and we are in the making of, really understanding all the different dimensions that, what is not called or named very often doesn't exist. So let's keep the hope. Let's keep, this transformative vision on words. And I would like to really recognize your time to all the speakers who, are bringing us this conversation and coming together for discussing, what does it mean for, to address gender transformative approaches in the work on men and masculinities. So let's keep the transformation focus and let's do it together. So thank you so much. Thank you everyone for joining this conversation, and we'll look forward to continue under the Ubuntu Symposium. The recording will be available, and we hope that we can continue working together. So thank you so much.